kind of explain this moratorium, that there really shouldn't be anybody getting evicted during this public health emergency, is what I understood.
That's right. And then on top of that, there are some federal protections also. In fact, there's several layers to this. So you really have to. I'd like to hear all the details about
Yeah.
this, but she shouldn't. And did she move? She ended up moving, or she stayed?
She moved out because they gave her a deadline to move out, and so she did what she could. She found a hotel, and she's been staying in a hotel for the last several months, trying to get help from the
That's
AG's
very
office. Yeah,
frustrating.
and she's been using her pool money to cover the cost of the hotel.
Yeah, we'll get down to the bottom of it.
All right.
Yeah.
Yeah.
You shouldn't. You There is a moratorium on evictions right now for
Mm-hmm.
sure, and uh, you know I have to piece together everything and figure out what's going on.
Yeah. Yeah. She
But
was
but
laid
as a
off, right?
general rule, if the minute that happens, you shouldn't. I think they're right. She shouldn't have moved, but besides the fact she did. We just have to get down to the bottom of it and piece the
Yeah.
details together and get her some help.
Yeah. All right. Well, thanks for helping her. And, we left off where
Yeah.
we were talking about the vaccine and
Yes.
the
So
distribution plan.
where we left off, as part of the planning, we're also now, because we're expecting the bigger doses that is going to be reaching into the community, within the next month, couple months. It's all based on preparing for it. So, in addition to getting all of the clinics on board, the medical providers, and polling them to develop the list of healthcare folks that are wanting to be vaccinated, and then that work will continue with the clinics. I believe that there are 25 healthcare facilities and clinics that will be registered to issue vaccinations as well, and then they will roll out with their testing plan, all reaching all of the people with the older people with comorbidities, those that are at higher risk. And additionally, we are starting to gather data this week on all people that work on schools or in early child care development centers. They'll be getting reached out and notified by public health as the weeks go on, to identify those that are going to be in contact with children, either at school or at daycare, and give them an opportunity to opt into a vaccine and get their priority lifted. That's part of the exercise that we're going on, so that we're prepared to kind of hit all the different sectors and offer those priorities to people who are willing to get vaccinated. And then that might include the media too, or at least
What was that?
and transparency, trying to reach as many people as we can. But this is obviously a set to reviewers of the vaccines for approval in the next few days, and then expanding the number of, and they're expecting the number of options to increase after that. We will not get vaccines that are not approved by the FDA, and vaccines are always going to be by choice. There's not going to be a mandate for vaccination.
Have we talked to Lillian, and she was mentioning that at least 70%, because they did a poll, 70% of her staff over there would be interested or would be willing to take the vaccine. And there were some that have some health issues and that they would not want to. But just in the preliminary surveys that you've conducted amongst the frontliners, what can you tell us about their response and their willingness?
I haven't seen the details yet of the. All I've heard is around the same percentage that Lillian reported. I haven't seen myself the actual data that's being used. There's an active team that's working on that, and I'll ask about that. But that outreach will continue with all the different pockets of groups, and we were able to share in the tabletop exercise as well. All of what the priorities are for the other areas in the Pacific, and we all seem to be on the same page in that regard.
Mm-hmm. Who participated in that tabletop exercise?
Well, it was conducted by FEMA Region 9 Director, along with head of CDC in the region and the HHS heads. And then also from Guam, the governor led the team along with the public health folks. And then same thing with the CNMI. Hawaii was led by the lieutenant governor, who's a good friend of mine. He's a doctor. American Samoa was their health department. Northern Marianas was also Steve Estramunia, who's the head of the Commonwealth Health Corporation. So there's another overlay because all the Pacific Islands are members of an organization called Pacific Island Health Officers Association.
Mm-hmm.
And there's already a considerable amount of interaction going along with the health agencies. So the tabletop, it lasted about maybe 3.5 hours. And then we're facilitated by one of the epidemiological experts in the States. And so this is basically part of the continued preparation of all the jurisdiction. There were similar tabletops that were conducted in different regions of the states as well, all happening concurrently.
Mm-hmm. Can we go back to, well, it's not necessarily Chantel's issue, but just the homeless situation? Because I think in previous discussions, the funding for the homeless shelter and the reason why the homeless shelter was stood up was because of the public health emergency. And the current declaration, I believe it would expire at the end of this month unless the governor extends it for another 30 days. You take a look at the CAR score where right now we've been maintaining it below 5. So I don't know if that's going to be a factor on whether or not we're going to be seeing this declaration go away or not. But although, whatever the case may be, are we going to see this homeless shelter continue even without this public health emergency declaration? Are we making plans for that?
Have been working with our fed.
I'm sorry. Yeah, you're breaking up. You're breaking up. LT.
Stable funding to have this non-target shelter in place. Can you hear me?
Yeah, if you could start all over. I'm sorry.
I'm sorry. Now I'm going into Naval Station for cut the ribbon. We will have. The governor and I have identified with our federal partners funding to secure that shelter and its operations for the next calendar year. And part of that will be coming up with a very good balance. Maintain transitional housing and get the case. Sabrina?
Yeah, you were really breaking up. You sounded...
Okay, Sabrina, I'll call you back.
Okay.
LT, if we want to just catch up tomorrow because we're cutting out a little early to live stream the mass for Santa Maria Comelin.
All right.
Is that okay?
I'll check in with you guys tomorrow.
Yeah, that's fine.
Thank
you, LT. Be safe.
Thank you.
That's
All
fine. Okay, Gus. Right on. 9:23.
Did you forward her
yeah,
her
I
number?
did. Of course. Gotta take a quick break, and we're coming back